Sisters United Outreach Ministry is proud to present Let's Talk Family, a woman, man, and family-centered TV ministry. This ministry addresses the whole person mentally, emotionally, physically, and spiritually throughout educational development, interpersonal relationships, and provide community resources.
Welcome to another segment of Let's Talk Family. I'm Sister Annie Allen.
And I'm Sister Good.
And I'm Sister Tina Edie.
And I'm Bob Sisley.
We're so elated that you have chosen this opportunity on this, I won't say bad, but inclement weather today. Snowing outside, but God still is good. So we want to thank you so much for tuning into this broadcast. Today we're talking about health care. You know, we have the Obamacare plan. Many people are confused about that. So we're going to elaborate on some of the plans they have. But before we get into our broadcast, we always like to give praise and honor to God. Because in God we live, we move, we have our very being. At this time, we're going to ask Sister Good if she would lead us into a word of prayer. And guess what? Our show will begin.
Okay. I would like all of you go to the Lord in your own way. I would just lead it for us.
Amen.
Oh, blessed and kind Heavenly Father, we are so grateful that you allowed us to be here this day. Regardless what the weather is, Lord, you're here and we thank you. And we thank you for our audience there that's at home listening, and hopefully, Lord, all of them in good health and their families doing well and everything that's going good for them, Lord. And ask a special blessing for those that are going through suffering this week, some I know especially, and some that are still asking for your blessing, Lord. And Lord, I ask that you bless us in a special way, Lord, to help us to be able to give our audience what they need, Father, because if we don't do that, Father, then it's not worth to have a show. Please, Father, give us the strength and give us the knowledge and the understanding to be there and to be able to help them get through whatever they need. And Lord, let everything go decent and in order.
Amen.
These blessings I ask in your holy and most divine name, Father. Amen and amen.
Amen. This time we're going to ask our dear Sister Edie if she would lead us into our sponsors for this afternoon.
Good afternoon. Welcome. And now here's important information that will put you in more touch with more data about our program. Minister Ronald Cross is the ministry of Metro Central Church, who reaches out to the world with the message of faith, located at 4455 Barham Street, Detroit, Michigan. You can contact their church or him at 313-640-9970. He also have Wednesday night Bible class at 7 o'clock p.m. He also have Bible Sunday class at 9:45 a.m. and service held at 11. And we're going to move on to our next church. Our next church is at Linwood with Minister Donnell Stewart. Come visit at Linwood and be blessed. Located at 1400 Linwood in Detroit, Michigan. You can contact them at 313-868-7795. And also, their classes are held Wednesday night at 7 o'clock p.m. Sunday early at 10:30 a.m. and also Sunday service at 5 o'clock p.m. And also, our next church is Liberty City Church of Christ, where you can get the word with Minister Mark Thompson. And they are located at 10624 East Jefferson. You can contact them at 898-2016. And their services are held at 7 o'clock p.m. on Wednesdays. Also at 9:45 a.m. in the morning, and Sunday service held at 11. And then we're going to move on to Veterinary Hospital with Dr. Morale. And they are open 7 days a week. And they are located at 15018 Livernois in Detroit, Michigan. Zip code 48238. And their number is 313-863-5350. Open 7 days a week, Monday through Friday, from 8 o'clock a.m. to 5 o'clock p.m. Also Saturday from 8 o'clock a.m. to 4 o'clock p.m. And Sundays from 8 o'clock to 2 o'clock with Dr. Morale for dogs and cats So get your animals there, please. Then we have Standard Rehabilitation Incorporated at 15785 Livernois in Detroit, Michigan, with Dr. Bello. Again, Dr. Bello, where they also have free transportation. And they accept Blue Cross, Medicare, PPOM, Great West, HMOs, and so on. Also, they do fractures, neck, back pain, work-related injuries, stress-related injuries, and so on. If you have any more questions, please feel free to give them a call at 313-934-2623. Monday through Friday from 9 o'clock to 5 o'clock p.m. Saturdays appointments only with Dr. Bello. And they have, again, free transportation. I encourage you to also go take a visit with him as well. Last but not least, we have Sister United. And we are also the sponsor of this program. We are the family-centered ministry. If you have any questions or concerns, please give us a call at 313-615-6323. And also, you may contact us by website, sisterunitedoutreach.org. Again, you may contact us by website with sisterunitedoutreach.org. And also, you can send donations through PayPal to keep our show on the air. Please make sure the donations go through Sister United Outreach. And also, you can see us live at www.vgntvgospel.com on Saturdays at 6 o'clock. Also, you also may see us at Fridays on Channel 20 on Comcast. I encourage you all to please send donations to keep us on the air. And let's get on with the show.
At Standard Rehabilitation Incorporated, located at 15785 Livernois in Detroit, we can take care of your rehabilitation needs. Dr. Bellows and his staff of healthcare professionals have extensive experience in rehabilitation and pain management. Our services include treatment for fractures, auto injuries, chronic and acute pain, work and stress-related injuries, just to list a few. Transportation is available. Dr. Bellows is standing by to service you at Standard Rehabilitation Incorporated.
Universal Home Health Care. They focus on delivering the highest quality and most efficient, best plan of care and quality service that you and your family require. They also focus in on congestive heart failure, also arthritis, GI disorders, bowel disorders. So you need to contact them at toll-free number. This is University Home Health Care. That toll-free number is 800-733-1659. Again, that telephone number is toll-free, 800-733-1659. So we want you to patronize our sponsors so we can continually be on the air. If you have problem with diabetes, COPD, wound care, all you have to do is call the Home Health, Universal Home Health Care. And you can tell your doctor, I would like to go to Universal Home Health Care because they are ACO providers. Again, that telephone number is 800-733-1659. So please, we ask you to patronize our sponsors so we can continually stay on the air. So today we're going to be talking about the Obama health care plan. Everybody's concerned about that, or what plan should I get into, how do I contact the agency. Now I'm going to give you a number that you can call if you have any question regarding your home health care plan. That number is 810. Again, that number is 810-318-2596. Again, that number is 810-318-2596. And when you call that number, it's going to introduce you to what they call a market plan. And in the market plan, you're going to press 0. Because many times they give you a lot of numbers that you contact. Sometimes we all get confused about that. They tell you, dial this number, touch this number, just press 0 and ask for a representative. All you have to do is press 0 and ask for a representative. Now they have a vast number of plans. The first plan that they have is the bronze plan. Now, many times I tell my clients, always ask for the most economical plan. Some that sound good, but sometimes it's not always good. So when I asked them, I said, okay, what does the bronze plan consist of? Okay, they said, you know, what was very attractive, they said, well, you don't have to pay a deductible. So then you said, oh, that's great, I don't have to pay a deductible. And it does sound good. But then I went on to ask them, I said, okay, it's under Blue Cross and Blue Shield. They said, yes. I said, well, now, if I get ready to go to the doctor, how much would I have to pay? $50. You gotta pay $50 for that particular plan. And to meet that, you gotta meet a deductible.
Now, when you say plan, you're talking about copay.
Yeah.
So every time I go to the doctor, I pay the $50.
Yeah, every time you receive a primary care from the doctor, you gotta pay $50 every time. And now a specialist is even more. So what you need to do is call and you say, I want to know about the bronze plan. That's supposed to be the most economical plan. And many of my patients fall into that plan because it's what I don't want to have to pay that deductible. I don't want to have to pay not primary.
It's called premium.
Premium. I don't want to have to pay that premium. But what happened is then you got to meet a certain deductible before you start paying a lower cost.
It's like a sliding
Yeah.
scale.
Mhm.
See what you have. I'm confused about this plan myself, so really I'm not going to be much help in telling you which way to go. All I can do is tell you to utilize the number and ask a lot of questions. We're going to, in the future, bring someone that has some expertise on these
That's true.
plans, because I'm just as confused as you are out there, and I don't want to confuse you anymore. Because this is your life and you need to know what's really there and how you can tap into it and how it's going to be effective for you and your family.
That's true.
Don't jump out there on anything because it says one thing of another, because as Mr. Scissor said, there's some of it is premium that you
Yeah,
have
most
to
of it.
pay.
Yeah.
And you can't afford that every time you get ready to go to the doctor for a head cold or whatever. So you need to get all the information. It's like making a cake. You don't want to make the cake and leave out some of the ingredients. So you need this.
So that's why you definitely have to call this number. And so when I was talking to the lady, she said, now, she said the most economical plan would be the bronze plan. But as you delve into it, then you got to pay the premium.
Yeah.
There's no premium, she said,
Right.
for Blue Cross. There's no premium for that. But then you got to meet a deductible of $5,000.
But it's
Okay.
my understanding with the Affordable Health Care Act that when I go to that site,
Mm-hmm.
all my premiums, copays, and deductibles are based on what I'm making. So if I'm at poverty, the government may pay my premium.
Mm-hmm.
It's not that there isn't a premium, it's that the government pays
Pays
it
it,
if you're
yeah.
below a certain level.
amount.
And I believe, you know,
That's what I read.
and again, I'm not certain exactly what that amount is, and you'd have to check it because it's gonna depend on your dependents,
Yeah,
whether you're
that's-
single,
that's
and
true.
all that stuff.
Mhm.
It's a formula that you have to check out. What we do know is that the bronze will always have a lower premium,
Mhm.
but if you don't go to the hospital, the co-pays are less, because if you don't have to go to the doctor, then that's why it's less. Under the Affordable Health Care Act, there's one thing you do get every year that's supposed to be part of every plan, and that is a yearly physical.
Mhm.
So you can figure out maybe what's going on with you. If nothing's going on, maybe that cheaper plan is the one to get. The silver, you may pay more in the premium, but you're going to pay less in co-pays and deductibles.
Mhm. That's
Or,
Mhm.
again, depending on your income, you may not have to pay any. You'll get
Right.
support from government
From the
assistance.
government, that's true.
And the same thing with the
Uh-huh.
platinum.
Mhm. And also
The problem I see with this, and I'm just going to give you an example. We had one of the members at the Gray Panthers who was very happy that his son got a bronze plan
Mhm.
for $49 a month. He's single and he makes $17,900 I think a year, $17,900. So $49 sounded good. he had no idea about the co-pays, deductibles that may come with that, but he's pretty healthy. So $49 he thought to have insurance isn't too bad. Then his sister, would be the guy's daughter, she made somewhere around 25, 26. She got a platinum plan because she has some children and stuff, but she's paying 200 and something a month. But then she realizes that she has to go more to the doctor, so she'll have less in the sense of copay. So you have to find what works for
What
you.
fits you.
And maybe some of it's not going to fit you very well at all. I don't know, depending on what you make. My problem with this is that I have seen over the years, whenever you have a monetary amount put to your health care, let's say this guy is making $17,900, suddenly goes up to the next level, which could be $18,000. He may get a whole nother premium that's way more than $49, just depending on how these scales are set up. So you never know where you're going to find yourself in that scale. It's just like when you do your income tax. You know, there's so much amount you
Right.
get back, and you make $2 more, you got to pay even more.
that's
You
true.
know, so that's how this works.
Exactly.
And that is why, you know, I know that the president brought us this. I know that it's an important step forward in getting people health care.
Yeah.
And that these folks will not be looking at bankruptcy, which is still,
That's right.
all bankruptcies filed in the United States, 50% of the bankruptcies are due to health care. So that's what this does. It helps stop some of that craziness that we've seen happen over the years. But one of the things we have to realize is that when the other side says, oh, this healthcare is so bad and it's complicated. Yeah, it's complicated. It's not bad, but it is complicated.
It
It's
is.
complicated because the other side wouldn't allow the president to bring us the public
That's
option.
right.
And what we need to
That's
do
right.
is tell
That's
that
right.
other side, we don't like it either, but this is better than what we had, number one. Number two, if you didn't give us the public option, now it's time to bring a single-payer health care for everyone, so that everyone will be in the same boat, and we won't have this stuff. Now, one of our problems is we look back and we say, well, why do we want government involved in our health care? Well, I'm here to tell you that in the 50s and 60s, we used to have a Blue Cross Blue Shield in the state of Michigan, and it was around the country. And you know how it worked? Everyone paid the same amount. Didn't matter what, if you said, hey, I'm going to go
Yep.
for Blue Cross Blue Shield, whatever it was, everyone paid the same amount.
That's
Didn't
right,
matter if
that's
you
right.
went to the hospital more than me or whatever, everyone paid the same amount. For that, you got your hospitalization covered,
That's right.
and you got your doctor's visits covered. And guess what? The system was working. If we all paid the same amount into the system, it would work. No co-pays, deductibles. It was a non-profit status, which meant they couldn't make money off of it.
That's
They
right.
had to use it
That's
for the
true.
purposes it was intended.
But isn't that, Mr. Sizzle, what the government is all about, money?
No, it isn't.
And they
No,
try
it
for
isn't.
them, not for us now. It's for them. And to try to keep us poor, because if they'd have kept that plan going, the people would have been much better, believe me, than what they are now.
Well, listen to what happened.
That was
What
a bad
happened
plan.
was other insurance companies looked at it and they said Blue Cross Blue Shield is taking care of all these people, and they take care of everyone. Again, that idea of we all help out our brothers and sisters. But these insurance companies said, wait a minute, if we only insure the healthy people, we will have less cost and we can begin to make some money off of this. So they decided that they wanted to make money off the misery of people.
That's my point.
And that's what happened.
Yeah.
And from that point on, we end up with the system we have. And every time we say something about it, oh, it's just because you haven't gone on a diet, or just because you had this, or you had this pre-existing. No, it isn't. It's that the American system became a system of selfishness and profit instead of a system of Americans and taking care of each one of us.
Because
That's what
right now,
happened.
like Blue Cross, now they are for profit.
Yep.
You know,
They,
and most
they,
hospitals
they
now,
gotten it stamped.
they are for profit.
Well,
Some
well,
hospitals
see,
now are for
The
profit.
key
too.
things is, Blue Cross Blue Shield of Michigan still has some nonprofit status.
Mhm.
What they conveniently done, if you go to Blue Cross Blue Shield, and you say, I want a Blue Cross Blue Shield plan, they're gonna say which one.
Yeah,
Because
no.
some of them are for profit, some are
Some,
PPOs, XYZ, and I don't even know the rest of them.
Mhm.
But see, what they've
So many
done
of them.
is disseminate ways of making profit.
Mhm. Instead of keeping that,
advantage they got. It's just so many nicks and crannies. While you're out there, please, my advice to you is to, before you do anything, but you gotta get registered. I think there's a deadline.
the 31st of March, you got to
There's
register
a
before the
deadline,
31st
so
of this
ask
month.
a lot of questions, you know, and talk to a lot of people and see which one benefits you the most. But you do need health care, I know that. Because none of us know when we're gonna get sick and what's going to happen to our family members.
Exactly.
So you wanna stay under the cover.
That's right.
And like, as he said, if you went back to his first plan, the president had a plan that would pretty near cover everybody. But the other side did see a term, a way that they could kind of mess with it a little bit. And
It
they
was
messed
called the
with-
public option.
Yeah,
They
they
wouldn't
messed
let
with
it
it a
out.
lot. And that's why we're in this predicament now.
And then they look back and say, oh, it's not working.
No.
It would have been working if they allowed the public option
Yeah.
to go forward.
Exactly.
So now you can call us at 313-615-6323 and tell us how you feel about it. Are you confused about this plan, as so many other people are?
They are.
Again, we want you to advise you to call this telephone number. You must be registered into a plan by the end of this month, March 31st. And that telephone number is 810-318-2596. So don't forget to call that number, and when you call that number, I know it can get confusing. It's gonna say Marketplace, but you're gonna press 0 and ask for a representative. And then all these different plans, you go through it, and their job is to explain these plans to you. Like you have the bronze plan, and ask them what the bronze plan entails. The silver plan, then they have the gold plan, and then they have the platinum plan. All these plans, and then under them they have Blue Cross, they have Humana, Priority Health, Consumer Mutual, all these different plans. Total Health Care Plan. So all these plans, you ask and see which one would be more feasible for you.
And keep
according
in
to your
mind,
income.
you may have a company like Blue Cross and Blue Shield, and they may be offering a better benefit under the bronze plan.
Mhm.
And then another company like Aetna or even HAP might offer a better plan under the platinum. So you have to
So
look
you
at
gotta
all
go
the
through all of
plans.
them.
Got to.
And one doesn't fit all.
That's right.
Exactly.
So you gotta go and ask questions, because if you don't, you find yourself, out of the loop. So take your time and ask them to explain these plans to you, what's gonna be more economical, feasible for you. So that's what we're asking you to do. Again, our telephone number is 313-615-6323. Again, that number is 313-615-6323. Okay? So call us and tell us how you feel about this plan. Is it working for you? Have you already gotten a plan and has it been working? I know we have one of our panelists. She's gonna talk about how that plan has affected her. So again, our telephone number is 313-615-6323. Call us and tell us what problem you have.
And I'd like to say, there are going to be people in any of these plans that will find them very, very good for themselves.
Okay, okay.
And the idea is that some people will benefit a lot. I know some people who've gotten a bronze plan who actually pay no co-pays, no deductibles, and they have Blue Cross Blue Shield under this. And that, for them, it's very good. Other people who have a little bit more income than this guy, they're paying out of the teeth and they don't know how they're going to be able to do it.
Exactly.
The problem with the health care is it should be equal for all.
Oh, equal, that's the key. He said it, equal for all, and one size does not fit all.
That's right.
Remember
Not
that?
under this
One
system.
size, don't let anyone tell you one size fit all. And there's nothing
That's right.
wrong with all these plans. You just got to find the one that
It's gonna be
fits
best
you.
for you.
Fits
Exactly.
you. Remember
That's
that.
And hopefully you find one that fits
Yeah.
you. There's gonna be some people who won't fit.
Yeah.
And
And
don't
then-
be afraid. That's another thing, cause I
can
see a lot of the commercials and the people do frighten you when they tell you this happened and call your congressman, cause this plan is not doing this and that. Their situation could have been different from yours.
That's
Remember
right.
that. No one size does not fit all. If you
That's right.
just remember that simple phrase, then you'll know that there is a plan there for you and your
That's right.
family.
That's right.
So
Now-
go for it.
I would like to make some mention, I don't know if people have seen, but there's a commercial out where this lady from Dexter talks about how horrible
Yes.
the
I-
Obamacare is,
Oh,
Mhm.
God.
and that the president had promised her her
Yes,
thing wouldn't have
I
to
hear that one
change,
every day.
and that she wasn't able to keep her doctors,
Yeah.
etc. Well, on the website, if you go look at it, fact finders have found that the truth is that she can go to the marketplace and find a policy half the cost of hers, limited deductibles, which would bring it under what she was paying just for her premiums,
Okay.
and that she has the benefits of the Affordable Health Care Act, which
Just one
means
moment, okay?
she can't be thrown off. She can never reach $1 million limit.
Mhm.
She can't be denied because of pre-existing conditions. And when she was asked, why would she do a commercial like that, she says she didn't know. And this is the shame, whoever made her do that commercial, they took somebody who was vulnerable, fighting cancer,
They do that.
and when she was confused, and that's why this is so complicated with this new switch, is that you have to go and try to put all this stuff together. And she had a change, but actually the changes are better for her, and she's able to keep her same doctor. So a lot of those things were found
Would you
not to
hold
be.
your point,
Okay.
Mr. Sizzle?
Correct.
Okay, now we do have a call on there. Welcome to the show, caller. What is your question or comment?
Yes, my name is Janila. I'm calling from Detroit, Michigan.
Oh.
And I'm calling because I have 2 children that's in college, and I would like to know, will the Obama plan insurance be good for me, or should I seek other insurances? Because when they're off to school, they can sure get in a lot of trouble.
Okay. So she wants to know, she has 2 children who are in college, and she wants to know about the Obama plan. Would it be an excellent plan for her? One thing, I would just call the number that we gave you, that 810-318-2596, and you have to research these plans. That's what my question would be to you, to research these plans and see if this plan would be best for your economical status and for your children. Mrs. Sisler has another comment.
But the issue is here. If you have a good insurance policy that your children are under the Affordable Health Care Act, the Obamacare Act, they are able to stay on your plan
It's
up
25.
through age 26. So therefore, if they're already on your plan, they can remain on your plan. If you get a plan, you should be able to get a rider for both of them so that they have health care up until they're age 26. That's one of the betterments of this plan here.
And
Okay, now,
there is some
do
elements.
you already have a health care plan?
No, I didn't know there was a deadline to sign up for the Obama plan,
Oh,
but
yes.
I hear there is, so I'm just trying to rush them into something, so they can be insured.
Right?
Well, let me
Okay.
say this to you,
Because
my,
there's a lot of the young adults now
Yeah.
that's running from 18 to 30 that's not insured.
I agree.
So
agree.
that you're asking them to, asking you to sign up. And you ask them, when you call that number, just let them know that how old your children are, and to see if they can be a rider once you sign up.
I think they can because my daughter has 2 sons off in college too, and she and her husband divorced. And he just dropped the kids for whatever reason, but that's not, neither here nor there. And she got them in the affordable Obama plan.
Okay.
So someone told her, she called me and I gave her the number that I had at the house, and I said, try this number. And she was able, those boys are out of state in different colleges, and she got them under the plan. So I'm certain you can find something that suits you, honey.
Mhm. So just call that number and just inquire about the different plans, because you
Yeah.
have 4 different plans here. So just inquire about which one would be better
Best for you.
for you and your children. Okay?
Thank you very much.
Oh,
You're
Thank you.
And thank you for calling. Okay. So, okay, Mr. Sisley, were you going to continue?
I was pretty much done, except that, you know, the conclusion was that the lady was better off under the present healthcare system for long range for her leukemia
Mhm.
than the plan she had, but it was just a matter of her having to go through what we're telling people to do.
Yeah.
Go through the process,
Mhm.
figure it out. One important thing is, if you are presented with a premium that seems too high for you to afford,
Mhm.
you can appeal that. There's an appeals board,
Yeah.
and then they will relook at what your expenses are.
Mhm.
And what I have heard is that people have been very, very pleased with the outcomes of the appeals.
And some of them, as I was saying, Mr. Says, my daughter had to go through that just recently. And
Yes.
she was just panicking because, as I said, she just had gone through a divorce, and her 2 boys are, one's out of state, one's in Columbia, they're different places, and the father somehow or another dropped the boys, or something happened, and then she couldn't put them on her insurance until the enrollment plan, because she's
Right.
working.
Mhm.
And someone on her job told her about this, about one of these programs on the Obama.
Mhm.
And she called around and she called me and I gave her a number and she said, I'm gonna go with this. And she got the best plan she was laying out for me, for her 2 boys. Cause she
Good.
was really panicking
Mhm.
through the Obama plan, through that affordable plan. So you just have to search through them and find out what's convenient and what's economical for you.
That's right.
And see, this is what you have to realize. These are insurance companies.
Yes.
So what has happened is there's some, and depending on what state you're in, and what the economic climate is, and how many people have signed up, the insurance companies will offer you different things. So it all depends on what insurance company may be offering anything at any given time. So that's very important. Now, what we do know is that since the Obamacare has come into effect, is that the general cost of some of this stuff is beginning to level out.
Mhm.
It's not going on the same skyrocketing trajectory that it had been
Okay.
on.
Mhm.
So it has began to have the healthcare corporation industry, whatever we want to call it,
Okay.
take a look at how do we keep some of these costs down.
Mhm.
And it has been effective.
Well,
And what-
I would like to mention that I went to Providence with no insurance. And with that being said, when Obamacare came out, they completely paid my bill 100%. And then they called me and told me they had me under charity insurance.
Mhm.
So I go to all their clinics for free.
Okay.
I go to all their doctors for free.
Amen.
And I also go to their pharmacy for free.
Now, you can't beat that.
Can't beat that.
Not with a stick.
Not with a stick, not waiting on my car.
Now, every case, now I want to stress to you, now, every case is
different.
unique.
Yeah, it's
So you have to
different.
call this number, and I can't stress it enough, 810-318-2596, and see what would be the best plan
She
for
was
you
blessed.
and your family. Because Tina over here, she was very blessed that she was able to go under this Obamacare plan, and now she paid zero.
Well, for example, for myself, I pay over $2,000 for premiums a year. And the company I work for pays a sizable amount even beyond that. And that's just the premiums. The only thing we get free without having co-pays and deductibles is that annual physical. Everything else has a co-pay until we hit a certain deductible, and then they'll pay after that.
Well,
That's the way
no,
mine is set up.
before,
And that's the way mine is.
well, before.
And that's why I'm saying everyone's gonna be different.
Yeah.
Everyone's gonna be different.
Yeah, because before that, I left my job, Detroit Medical Center, and went straight to Wayne State University as a student, full-time. And I was under a program that was BCCP. And I went to
Okay.
Beaumont for the last 3 years with everything, mammogram, physical, I'm not gonna say everything.
Here's what you did.
Everything.
Everything was paid.
What I needed
Yeah.
for, and I didn't have to pay anything. All I had to do was sign papers.
That's a
They sent me a
blessing.
packet.
Yeah, but no
I
no
fill out-
co-pays, no deductibles.
No.
So who was paying it?
Pardon me?
From the government.
Well, it was a government.
It was the government.
Yeah,
Okay,
it
well,
was the government.
see, it all depends on
But
what you
see,
got.
parents, people have to understand when they go to certain clinics and you pay them out of pocket and you really don't have it. What you need to do is ask questions. I always ask 1,002 questions. And that's how I knew about the program. And that's why I was going to Beaumont, and I love Beaumont.
It's a good
For the
hospital.
last 3 years,
That's
yes.
a good hospital.
I was in and out. It was excellent. Now I'm
Now,
okay.
Beaumont paying you to say all this?
No, they're not.
If they
Well-
are, then you keep saying it loud and tell somebody else to
Oh, we
go to
buried a
No,
lady
but I
last
was
year
just
who
saying
said she
what
didn't
clinic
like
I was
Beaumont.
going to under that BCCC
Well,
program.
I mean, you can go, that program is offered in most places though.
Yeah.
You know,
For
you know,
women.
Yeah.
Mhm.
you know what I have found in healthcare? And I want to say this. Last year, there's a lady who died. She hated Beaumont. That's what she said. Oh, she never wanted to go to Beaumont, no matter what happened. She didn't want to go. It all depends on where you feel the most comfortable.
That is right.
And for us to advertise, oh, there, all the doctors go here, or this is rated
Yeah.
number 1 in the country.
Yeah.
No.
I don't care what's rated number 1. You know what?
Mhm.
If I'm sick and somebody takes care of me,
That's
that's
the
all I
greatest
care
rated
about.
number.
That's the
That's it.
greatest
That's the
person.
greatest one.
And it may be somebody I know, it may be a stranger.
Yeah.
But if that stranger is a good Samaritan and you're choking, and they come up and they
That's
do the
right. That's the
Heimlich
greatest one.
maneuver on you,
Exactly.
right.
guess what? They're
That's
the
the
best.
greatest.
Exactly.
My husband went to Beaumont a whole 15 years he was sick, and I
We're not
admire him.
advertising
Go
for
ahead.
Beaumont.
I admire them, but he had regular insurance.
Mm.
The Obamacare wasn't out then,
Yeah,
but
but-
they were just too ridiculous.
Just to say
But
this.
as everybody like what they like, as Mr. Scissor said, whoever come get the bone out my throat, that's my
That's gonna be
place.
the best.
Well, I will tell you what,
Exactly.
and I'm gonna do a plug for DMC, back in the day. Whenever you were sick and someone couldn't figure out what was wrong,
Yeah.
there was a young
DMC.
man that we took him to a number of facilities. It was Samaritan Hospital at the time, couldn't figure out what was wrong.
Yeah.
Took him over to Beaumont Bonsecourt. They said he had indigestion, but he couldn't stop the hiccups. I called someone at DMC, that he was admitted. They did all the proper tests. He was suffering of lung cancer.
Mm-hmm.
The other 2 places had misdiagnosed him.
And that can happen.
I'm just pointing that
That can
out.
happen. That can happen.
Back in the day, they'd say go to DMC. You know
Every
why?
time.
Because the DMC saw everything. They have so many emergencies, so many things going through that facility.
And we
That,
have our
that
own
if you went
preferences.
through there, they knew
Yeah.
what it was they're looking at. Not from something they read in a book, but from something they had seen.
Yeah.
That's why DMC used to be.
But I go to Providence now because they did my insurance.
Right, right.
So I have to go
agree.
where
Yeah,
insurance
right.
takes you.
Correct. yes.
Again, if you have any questions or comments, things that you want to discuss, if you've had an experience, you can call us at 313-615-6323. Again, that number is 313-615-6323. And ask your question, because everybody had different experiences.
They do.
But I do encourage you to call that number, and we can't just have to keep reiterating to you how important it is to call. You must be registered for a healthcare plan before the 31st of this month.
That's important.
March 31st, otherwise you're gonna be, they're gonna penalize you. So you need to call that
Well-
number, 810-318-2596. Now, that's what they were saying. You must register. You must register. Okay?
It's not so much that they're going to penalize you, penalizing yourself if you get sick and doesn't have
Well,
any insurance.
there is some consequences.
So you know you have to meet the deadlines in order to get any services. That's just the way it goes.
So
But you
call
hurt
that
yourself if you don't get yourself in some type of insurance out there.
number.
And the more you know, knowledge is power. I
That's right.
believe in checking anything out about anything that I'm going to do. And I call a whole bunch of them before I make a decision. So just check around and call around and talk to people. You got a few more days. March the 31st is 2 or 3 weeks away from here.
That's right.
So just,
And I think we
These
should
3
talk
weeks.
about what the penalty might be.
Okay, why don't you
If
explain that?
you do not sign up for a healthcare program, the first year, and it's kind of interesting we're doing this March because
Mhm.
April 15th is tax day. What'll happen is next year, when you do your taxes,
taxes, they go-
you may be fined.
I figured
And the
that.
fine is, at least at this point, what I've heard, is $95.
Mm-hmm.
And they may raise that, they may not, they may actually implement it, which means they may actually fine you the first year, they may not.
That's right.
But they are hoping that people will see that by coming together and everyone buying insurance, and it has brought the price to a stable amount, it may even reduce it more.
And see, what you need to do, remember, March 31st is the deadline.
It is.
So next year, you worked all year, you file your income tax, and then you get this statement. $95 taken because you did not register for your insurance. So please go and register. Again, that number is 810-318-2596. So please register, okay? And it's very easy. Just call them and talk to the representative. It's their job to walk you through all these different plans
It is.
until you understand what you're getting into. Then you can talk with other people, but still, every person is unique.
Yeah.
And every case does not fit all. Like one size does not fit all.
No, it
So you
doesn't.
really have to let them know, ask questions about what would be more beneficial for you. Okay, any more comments regarding the health plan?
The only comment that I have is that you love yourself first, okay?
Mhm.
It's imperative to let you understand that nobody should have to penalize you to make sure that you get the best that is out there.
That's right, for you.
You got children and you got your soul and you got all your family members. Just make everybody aware how important you are. And you're the most important thing I know. So
That's
I
right.
know for
Amen.
yourself you're the most important thing.
Mhm.
And the most important person, so take some time for you. And mothers, you take some time for your children. We always been accused of overdoing for them, so keep on overdoing it to the 30s. And after that, you can let them become independent. But right now, you take the reign and make sure that they are registered in some type of program. Where if something happens, they okay, and it won't be on your mind to worry about it
Mhm.
Right.
and
That's true.
struggle with it, because you know how kids are. They slow drag around, and some of us do as well. Just make it imperative and then make it part of your agenda to do this right away, okay?
Mhm. Amen.
We already at the deadline. It's too late that we wait this late to tell you this. But sometime the later the thing is, the more urgent we jump on it.
Well, part of what we have to realize that our state was in a dilemma about
Yes.
what they were going to do
Yes.
for so long, and it wasn't until later that they made law
Okay, can you hold your
about the
comments
plan.
on? Good afternoon, Miss Allen. Welcome to the show. May we help you? Do you have any questions or comments?
Ability, your disabled adults or veteran or something, do they apply? Apply to them for the veterans and disabled people?
Is there a plan for
Is there a
them?
plan for them? Because many of them are
Wait,
already-
each one of those groups are different.
Different, yeah.
If somebody's on disability,
Yeah,
they
it should be already.
depending on the disability, there are some disabilities that will give you Medicare straight out, HIV, certain forms of cancer, certain forms of dialysis will give you 100% disability and Medicare automatic. And I'm not certain, those are some that I know about. There's probably more disability statuses. Veterans are that are service related have to go,
Yeah,
well, wait a minute.
VA.
It's not that simple.
okay.
Veterans, again, have a system that's set up similar to the Affordable Health Care Act. So if you're a veteran, they have to decide what your disability is and whether or not it's definitely related to your service. So they make a decision on what percentage of your health care may be covered through them, what percentage may not be.
Based on your injury.
Based on your injury at the
Okay.
time that you did your service or something related to your
That's
service.
okay, that's all right.
So, I mean, but go to the veterans,
Yeah.
try to work through them.
Yeah.
And then if that doesn't work, then come into the Affordable Health Care Act
program.
system, which is then supported through the state Medicare, Medicaid system.
So did he answer your question?
Yes, ma'am, thank you.
Okay,
Anything else?
thank you for calling. Anything else? Okay, that's true. This is a good idea.
Maybe we
Most
need
of
to
that-
reiterate on that again. What he was saying is that certain specific organizations also have a program for their person. So call them first and see what they got going
Good
before you
afternoon,
go.
welcome to the show. Can we help you?
Sitting here watching your show, and I would like to know, what if you have any pre-existing illness, such as cancer or amputation? Will the Obamacare still, pick you up? A lot of insurance companies won't pick you up if you're already ill.
Yeah,
By
that's what
law,
he said.
they
They got
must.
to.
By law,
They
they
got
must.
to.
Now they must.
Yeah, they must. Before, they would stipulate if you already have a pre-existing condition, then you were not insurable. But
That-
now. you
That's
gotta
why
get
it was
insured.
important. That was one of the benefits when they were talking about that lady who has the leukemia and talks so
Yeah.
bad about Representative Peters. One of the facts are that with the Affordable Health Care Act, she cannot be thrown out. Whereas before, someone with leukemia, and if it extended over a period of time, the insurance company could just drop you in the middle of your treatment.
Yeah.
And now they cannot do that by law. So that's one of the benefits of this program that the lady doesn't
Which is
realize she's
important.
talking
Which is
against.
Very nice.
Yeah, that's right.
Very nice.
So,
That's right. So did he answer your question?
Yes, tell Mr. Scissor I said thank you very much.
Mrs. Sisler, she
welcome.
said thank you very much. Okay, that has been, but we are gonna try to have someone to come on the show and really talk about this Affordable Health Care Act and all the different plans, the bronze plan, the silver plan, the gold plan, and the platinum plan. So you have more of knowledge about what to ask for. Hopefully we'll be able to do that before the end of the month, to have someone else to come on and talk about that. So we're working on that because our objective is to make sure that you have the information that you need for you and your family to make the best choice before the end of the month, March 31st. So make sure that you sign into a plan before the deadline. The deadline is March 31st. And if you don't sign up, you will be penalized. And you don't want anybody taking your money from your income tax. So because you monitor that, and so you already made provision, what you gonna do with your income tax money. So make sure you sign for a plan so they won't touch your income tax check.
well, the major concern here, it may be easier to pay $95 than it is the premium. But a lot of times what people don't realize is without some kind of coverage, if you end up going to the hospital, a simple bill for a few hours can cost you thousands of dollars.
That's right.
And once you are identified as not being able to pay that bill, and sometimes it's $50,000 in one shot. I know I went for a simple procedure and they tried to charge me $3,000. I had to fight with them about that. But here's the point. You don't pay it. It affects you in other ways. For example, right now in our state, the #1 cost on car insurance is your credit rating.
Yeah.
Yeah.
So if your credit rating gets ruined
Bad.
because of you not paying health care, you're screwed when it comes to just being able to drive a car. So whether we like it or not, these laws have been set up by
They're linked.
companies
Yeah.
that are linked right
Right,
now
with
with
everything.
finance.
That's right.
They
So
linked
that's the
together.
main reason you should try to get this, so you don't fall victim to that
Yeah.
system. Until we get different politicians in there that will change these laws to make some sense.
That's right.
For example, why should your car insurance be based on whether or not you have good credit rating?
Exactly.
Should it be based on whether or not you
That
drive right?
That's
Yeah,
what it
that's
should
right.
be.
Whether or not you're drinking and driving, whether or not you're taking medicine while you're
That's
driving?
because of the ones that making the law has found a way to link everything together, whereas they
And
can put
charge
a penalty on you. You got to pay a penalty, so you choose the penalty you want to be paid. Yo, you got choices.
Yeah, but the penalty we pay is when we
Yeah.
just allow anyone to go over there and
Yeah.
represent us in Lansing.
That's right.
That's our problem.
That's right.
And we got to
Or
learn to stop
Washington.
doing that.
There you go.
And we got to learn to vote, and I tell them so much when I'm out all the time. Vote for the right, and don't just vote. Find out
Make sure
something
you
about
vote
John
for
Doe or whoever. What is he do? Where he
What
comes
he has
from?
done in
And
the
this,
past.
yeah, and I also want a record check on him. So
That's right.
you got to be proactive when dealing with your life in general.
That's right.
So always be inquisitive and want to know what's going on and what's in this for me. If you keep that at the top of your head all the time, you won't make too many mistakes. What am I going to gain out of this?
That's
Or what
right.
am I going to lose if I don't do this?
That's
You
right.
can't do anything but win or lose. So you decide which way you want to go out there.
So
Okay?
remember, before the end of the month, March the 31st, you need to call this number, 810-318-2596. And when you call, you will get an answer. It will say Marketplace. And press 0 and speak to a representative. And ask them to explain these different plans to you. Don't listen to Mary Jo next door, because her plan might be different from yours.
Yeah.
Her situation is different from yours. So you ask them about the plan that's going to be conducive to you,
Amen.
beneficial for
That's
you.
true.
So make sure you call that number before the end of the month, March 31st.
Can
Okay?
we hear from Miss Stevens?
Okay. At this time, our dear Tina, she will be leaving our show. She will be coming back periodically, and we'll be
We're gonna
also
miss
on
her
her
so
show.
much.
Yes, we are.
So we are. She has a new show that's going to be coming on. It's called Touch of Class TV show, and it airs every third Monday of each month, 12 noon on Comcast 20 in Detroit. Why don't you announce it? It's your
This
show.
is your show, and this is your lady shout.
Yeah, I'm announcing your show.
That's okay, that's okay. You
Well,
all
tell
know
us about it.
Tell us
Congratulations. We're
about
so
the show.
happy.
I'm
Well,
crying.
I'm excited. It's new and I'm a little nervous, but thanks to the panel here. I'm going to school for communications and journalism, and that's the purpose of doing the show.
Okay.
And it's only once a month, and it's throughout our community as well as you get your guests. I'm going to be doing the same thing,
Okay.
and I'm going to just be one-on-one instead of, panel.
Okay.
So I'm excited.
Oh, okay, so we'll be looking forward to coming on your
Okay,
show.
Of course.
And we have to come back and interview you about the show, which was happening, and all these good things. And we always encourage people who would like to go on, because this is just a stepping stone.
It
so
is
you
a
can
stepping stone.
Go on and pursue your endeavors. And so
Thank
we
you.
want to congratulate you,
Thank you.
and may God be with you.
Thank you.
You're doing
What
an
station is that,
excellent job.
ABC?
It's gonna be aired under www.bgntv.net.
Oh, okay, not ABC.
Not yet, she said, not yet, that's coming in.
Not yet.
But we also have another guest of
Yes, we do.
Mrs. Sisler that's in our audience. Would you like to come up and say hi to our audience? Oh, but why don't you tell us your name?
My name is Jamila Abdul Malik Grigsby.
Okay, Mrs.
Nice to
Sisler.
meet
Nice to have you.
And it's very nice to have you in our audience. If you would like to come and be our guest, call us at 313-615-6323. And you can come in too and sit in on in the audience out there and ask me the questions as you would like to have. Again,
I'd like to make an announcement
Okay.
before Tina rehearsed the sponsors we have. We for one of the sponsors, Metro Central, they're going to have their anniversary on the 15th of this month. It's going to be at St. Cecilia. It's on Livernois and Stearns. And going to have a lot of gospel groups, a lot of singing, and it's free. A lot of food, and you know you love to eat. Come out and eat and hear all this a cappella singing. You can
All
hear
right.
from 6 to 9 on the 15th of March. Come out and enjoy yourself. It's at St. Cecilia. Everybody know where that is. It's not too far from the Burger King, McDonald's, everything right there. So
Okay.
you know where Grand River and Stern is. So please come out and enjoy yourself.
oh, very good.
Put it on your calendar. One of our sponsors is the anniversary.
Yeah, Metro Central Church of Christ.
Okay?
And also I have another production that's coming, Crucifying a Color. So Mrs. Sisler on the end and many of us, Sister Good, and all of us gonna be on the show. So we want you to, it's gonna be June the 14th, Crucifying a Color. It's about racism. So we want you to really take an interest in this program, this play. Kenneth Johnson, he wrote it, but we want you to come out and patronize it. Amen.
This is our last call.
This is our last call. Welcome to the show. Do you have any questions or comments? I'm
Yes,
sorry.
I'm just trying, what was the subject of the story?
Well, today we were talking about the Obamacare,
Affordable care.
Affordable Care Act.
You're talking about Obamacare and the Affordable Care Act?
Yeah, we were
Yes.
talking about that. We were talking about, and we gave out a telephone number. If you have any questions, you can call, but we're running out of time now. I'm sorry, you just called. 'Cause we want-
Okay.
Okay.
Do I have time to ask the question or no?
No, but you got a phone
Or you got
number.
30 seconds. 30
You
seconds,
have
give us the
30
question.
seconds.
What did you want to ask?
Well, the only concern that I had was that a lot of people don't realize that if you don't get into some type of health insurance,
Before
get
the
some
end of
type
the
of health
month?
insurance, that you're gonna suffer a tax penalty.
Yes, we talked about that today. Yeah, they have to sign before the end of the month. Otherwise, you're gonna be taxed $95. So we ask everyone
The end
to.
of this month, the end of March?
No,
End
the
of
end of
March.
March. So make
Yes,
sure
ma'am.
you sign up, okay?
So
Before
Okay,
the
well, a
end of
lot of
March.
people don't know that, so the media has to do a better job at getting this out to the masses.
Okay,
Thank you
so,
very much.
okay.
You have a blessed one.
you,
Thank you.
Bye.
God bless you.
Right there.
okay. We want to thank you so much for tuning into our broadcast. We thank you for coming. You know what? We love you, and guess what? There's nothing you can do about it.
Contact us at 313-615-6323 and send your donations to P.O. Box 40154, Redford Township, Michigan 48210.
What's going on, y'all? It's Mr. Bell. Some know me as Antone Quarboy Bell. Others know me as Elder Antone Bell. I am co-CEO of Bell Global Network, VGN TV 2090. And I want to invite you right now to get your own broadcast. Calling all ministries, all politicians, all business owners. Get your own broadcast right now, starting at $99. And if you have an idea for a TV show, we can bring your idea to reality. We have packages available that includes production and facilities. Also, we have advertising packages starting as little as $25. So don't hesitate. Give us a call at 313-355-7877. Once again, that's 313-355-7877 to make an appointment today.